All right, this is Inspiring Women. I'm Laurie McGraw, and I am speaking with Rachael Jones, and she is the CEO and founder of a new company, Syntax Health. We are doing an Inspiring Women collaboration with Redesign Health. Syntax is one of those companies, and I asked Redesign to, can I speak with some of your top, best, most exciting CEOs? And Rachael, you are here, and I'm excited to speak to you.
Thank you so much. I'm so glad to be here.
So let's get started on Inspiring Women. So you're here at the health conference.
Yes,
You're here talking
yes.
about Syntax Health that
Mm-hmm.
came out of stealth just a couple months ago. But before we get into the company and
Yeah,
what you're doing there, you're 20 years in healthcare. You're an expert in
yeah,
value-based care. You're a deep data and algorithm expert. Tell me professionally, how did
yeah,
you get here? A
yeah.
little bit of the bio sketch.
Absolutely. Happy to do that. And again, thank you for the opportunity. I'll start with a personal piece first, if that's okay. I was born in Jamaica and I came here when I was 10 to the US. And, I think as part of our culture, first generation immigrants, we're driven to succeed, right?
Yep.
It's sort of in our DNA. And so pretty early on, I wanted to be a physician. Shocking to no one that, that's like the gold star. And then as I went to pursue that, I realized what I was more interested in is the systems and why. How did the patient get here? What's the backstory? Do they have, the right support system and structures to help them stay healthy once they get healthy? And I was encouraged to go to grad school and be a hospital administrator. So I actually started my career in the hospital space. And when I was at the hospital, I just got fascinated with quality and data and management and understanding sort of how can I use data to tell a story, right? And really connect the dots of understanding between a lot of these complex principles and day-to-day practical work. And I went into the health payer side from that to really start off with taking balanced scorecarding processes and quality processes into the insurance space.
Okay.
That lasted about 2 seconds because they're like, oh, wait a minute, data? We need help with analytics
Uh-huh.
for network contracting and for provider contracting and health analytics.
Uh-huh.
And that just sort of led from there. I sort of took that first pivot from the hospital space into the payer space, and then went into the product space and worked at a product company and ran product solutions. And then I started to see the magic of automation and data together and how to bridge that gap between telling stories with data and then bringing it to life with data and tooling and automation efficiency. And really just sort of led that track and advancing up through different parts of, healthcare management and leadership, ultimately led me to Cotivity, where I led the quality and analytics team for a couple of years. But really building on all of that experience, I think what brought me to Syntax was the opportunity to do three things in my career. One, have the autonomy to really lead and execute a vision of my own. And having worked in places like Anthem and Health First and Cotivity, seeing the impact of having a really strong vision on how to impact change on scale was something that I wanted to do, in this environment. The second was to do something where I could work with a team of folks on something really special.
Yep.
And I've been very fortunate to not only have the Redesign team, but to build a team at Syntax that's really passionate about this idea of transparency and trust as the two keys to unlocking value-based
Okay.
care.
Okay.
And the third thing for me, I think if you know the Clifton Strengths Finder, Laurie, do you know
Yes,
that?
yeah, I know that.
My number 3 strength is significance.
Okay.
And so doing things that matter is really important to me, and having a legacy is really important to me. And you think about what greater things that matter than healthcare,
Yep. Yep. Well,
right?
there is so much to unpack, okay, in those three things. And so
Yeah.
I think significance is where we're going to end. But before we
Yes.
get there, just in terms of the data that you started with, I mean, I've been in healthcare longer than you. And we used to talk about when there's all this data, there is so
There's
much
so
data
much
out there.
data.
So the fact that
Yeah.
you know not only how to use it, but also analyze it in significant ways. And now we're moving into the value-based
Yes.
contracting space, which you know quite a bit about. That's exciting.
Yeah.
So brings us to Syntax.
Yes.
So you're
Yes.
excited about it,
Yes.
obviously. What does the company do? Why does it matter?
Absolutely love that. So Syntax is a SaaS platform that sits, I like to say, at the intersection of analytics and collaboration.
Yep.
So we're all about focusing on accelerating value-based care, and we do that through 3 ways. First, we help to reduce the time it takes to get to a deal. Today, on average, it takes about 12 to 15 months to negotiate one provider contract.
Okay.
That's simply too much time.
Yeah.
Right. So we focus on how can we bridge
But
that
how do,
time.
but even like I don't know. Like
Yeah,
what is a
absolutely.
normal amount of time to negotiate a contract?
Normal should not be 12 to 15
Okay.
months.
Okay, I knew that. I did know that.
If you think about that, right, that means that the patient who's at the center, right, value-based care, if we dial it back a little bit, right,
Yep.
and think about what value-based care is actually all about,
Yep.
right? Value-based care means that the physician is thinking about what's the right care model, care delivery model that aligns the best outcomes for that patient.
Yep.
Right? That's kind of what we talk about health equity. That's the new word, but
Yep.
the idea of patient-centered care
Yep.
is what value-based care is all about.
Okay.
So it's aligning a clinical model and a financial payment mechanism.
Okay,
right?
and I'd like that you say clinical first.
Yes, because that's the point.
Yeah.
It basically, if we think about why healthcare is a runaway train of costs, it's that we're doing all this unnecessary things, right? Expensive tests, expensive drugs, expensive therapies that may not be the best thing for that patient.
Yep.
Right. So if you have a physician mind that's thinking about the clinical delivery and the financial incentive, right, then you have aligned care.
Yep.
And
Yep.
so when you think about what we're doing at Syntax is really solving for how do we get more of this,
Yep.
right? We kind of have this log jam where the old way of paying fee for service is how folks are used to getting paid.
Right.
And so when you think about trying to increase and sort of, bring in an alternative payment model through value-based care, it's like, what is that? How do I understand that? That's scary to me. I don't want to take on a risk.
And we've been talking about value-based care for
a
quite
long
some time.
Yes.
And I've thought it's really for those reasons. I
Yeah.
didn't know about the length of time to
Yes.
negotiate one
Oh
of
my
these
gosh.
contracts. The
Yeah.
fact that you're
Yeah.
solving that, which seems ridiculous, is just like one of the
Yeah.
benefits for Syntax. But what is your take on value-based care? Are we really there? Are we on the threshold? Is
Yeah.
this happening at a
Yeah.
level of pace that we're going to cross this chasm?
Yeah, we have to because we cannot sustain 20% of our GDP, right, with
Yep.
healthcare costs. That's
Right.
more than some developed countries in the world.
Yes.
Right?
Yes.
And so when you think about what we're really talking about in this sort of myth of value-based care, number one, we're calling things value-based care. That's not value-based care.
Okay.
It's glorified quality programs, right?
Okay.
True value-based care is patient-centered population health payment.
Okay.
Meaning you're thinking about what's a group of members that I'm going to now sort of attribute to a physician and take on risk for these quality and cost metrics.
Okay.
But if we just hold on that concept for a second, the reason why value-based care has been around for a long time, as you said, but really hasn't taken hold is because three things. One, we make it too complicated for folks to understand what winning looks like. At Syntax, we have this concept of best fit design, right? Value-based care is not one size fits all. And you have to really understand what's the best payment model for this physician and this member or this patient cohort.
And what's in that? Geography as well?
A lot of things. It could be geography. It could be the condition. Perhaps if I'm taking care of, I'm an orthopedist and I'm doing knee surgery, perhaps bundles make sense for me,
Yep.
right? Because I'm doing best practice evidence-based medicine for bundles. But if you're a primary care physician, bundles may not make sense for you
Yep.
because you're seeing everything from colds to flu to broken bones.
Yep, yeah.
So a total cost model makes sense for you.
Yep.
But unfortunately, as an industry, we've kind of glummed it all together.
Yep.
And we haven't thought about what's the best fit model design
Yep.
for that patient and that provider group to make them most successful.
Yep.
And so you have providers who are signing up for things they don't understand.
Yep.
And then getting to the end of the measurement period and not getting a check. And they're
Yep.
like, well, why did I chase my tail for all this for what?
Yep. And I've heard those stories
my
too.
gosh,
And my
yeah.
goodness, Rachel, when I called you an expert in the area of value-based care and data, I didn't know how much I meant it.
Thank you
I
for
mean,
that.
really,
I
my
appreciate
goodness.
that.
So you,
I'm a little
you're-
passionate about it, as you
a little bit. You launched. So what is the company focused on first?
Yes. So our vision for Syntax is really to be that end-to-end tooling and infrastructure
Okay.
for value-based care. We started with modeling first.
Okay.
Because when you think about and walking the health floor this week, right, you see a lot of companies doing population health, patient engagement, physician activation, risk coding accuracy, all the things.
Yep.
Very important for value-based care enablement,
Yep.
right? But what's missing is that upstream focus on best fit design and enabling efficient collaborative modeling.
Yep.
So we have a point of view that you can't fix poor design downstream.
Right.
And no amount
and it's really expensive to fix it downstream.
Absolutely. And no amount of care intervention will solve for a payment model that's flawed.
Yep.
So we focus on, in our beta solution, really focused on how do you get the best fit model? How do you do so efficiently to cut down the back and forth, the emailing, the PDFs, the sort of death by 1,000 cuts, right?
Yep.
And then how do you do that collaboratively? So I think what's unique about our solution is a two-sided solution that has both the payer and the provider, right? Or the digital health company and the payer, or the provider and their other providers in the same sort of pool.
Yes.
They can negotiate live.
Yep.
It's a dynamic platform. You can change
and that's
terms,
what cuts down that 12 to 15 months you were talking about.
There's no battling of dueling spreadsheets and dueling actuaries.
Yeah.
You have the financial and sort of credibility in the actuarially sound model, but you have a software tool that automates the contract build and allows both sides to negotiate together, which is really the point of value-based care. It's a team sport. It shouldn't be this head-to-head combat. It should be, how can we create a win for all of us?
Okay, so the time is now for value-based care, true value-based care, and you're leaning in to make it more efficient and focused, clinical first, financial second, but full package. Okay, I want to dig into, a topic around that, and, being a data expert yourself, and I know that you are also very passionate about health equity. That is something that you bring to the table. And one of the things that we know about health equity, and everyone's talking about it, is that with all of this data, there's bias in the data. A lot of the data is dirty data. And, there's pockets of missing data. And with all these wonderful algorithms and everything else, that can actually result in furthering the equity divides. So I would just love first of all, your perspective on it, just generally, but then also as you think about it, how do you separate just the talk about health equity versus like what really needs to happen?
Yeah, I love that question. I'll tell you why. One, I think I'm so excited to see that we've now created a lexicon for this conversation around health equity, right? It's not a novel concept to think about the unique care that I need as a 45-year-old Black woman, right? Versus the care that you might need in your stage of life, right? Health equity is all about...
Kind term, my stage of... Thank you, Rachel.
Listen, I'm also seasoned. And so at the end of the day, our care needs are different. Our medical histories are different. And health equity is all about acknowledging that your needs and my needs are different, and our care should match the needs that we have, right? That's the big picture.
Right.
But how do you boil it down into something that's actionable? That's where I think data comes in. And I'm glad that we're finally starting to collect data on things like social determinants of health. Where you live impacts your health. Where you go to school impacts your health. Your earnings potential impacts your health. If I have to worry about paying the rent or paying the light bill versus going to get go to the doctor, I'm going to choose the light bill and the rent.
Right, exactly.
So now we have information about where people live, how they live, what's their health factors, right? What are the things I'm more predisposed to given my health makeup versus yours, right? Now we do about that. That's where value-based care comes in.
Okay.
Because now you're saying if you can now align the incentives for the physicians and your medical group, right, who's thinking about your care in a way that ties to the unique factors that determine your health, right? So now we're sort of marrying health equity with value-based care. We can then funnel the resources that you need through the value-based care mechanism, right? Because when you think about fee-for-service today, it's all about billable codes, right? If I have to go for a flu shot, or if I have to get a vaccine, or if I have to get a test, that's a billable code. There's no billable code for food. There's no billable code for having to get you an air conditioner because it's, because you're in a high-level apartment and it's sweltering heat in Bronx, right? So now you think about if you're incentivizing folks who are coordinating care through a financial mechanism of payment called value-based care, they can redirect those resources that have no billable codes.
And so, Rachel, you also have a background, on the payer space, and you also know that a lot of the healthcare access and delivery issues have to deal with affordability. So how do you use that data lens in building out these contracts because the desire is to have better patient outcomes, and some of that better patient outcomes, a large part of it is affordability. affordability. Right.
And I think I'll give you one example. So when I was at Anthem, now Elevance, and our value-based care program, our total cost of care program, one of the key tenets was this idea of a care coordination fee.
Yep.
Right? So that's just a PMPM that was risk-based,
yep.
that acknowledged that for that provider, they need a little kicker, if
yep.
you will, to invest in addressing access and affordability.
Yep.
So some practices might extend office hours,
yep.
Or have a Saturday office hours for folks who can't get off their job in the week.
Yep.
Or they might have nurse practitioners.
Yep.
Or they might have home calls or home visits. It's really giving that provider the autonomy and the agency to use those funds as best as they need for that population, but acknowledging that you need to have that upfront investment in
yep.
the EMR or whatever it is to do that patient-centered care.
Yeah. Well, first of all, again, your knowledge and depth in this is just incredible.
Thank you.
Your passion is just shining through, and I am rooting for you, in Syntax Health because it sounds like you have the opportunity to really make an impact and a difference.
Yeah.
I want to sort of turn our Inspiring Women conversation back to you.
Okay.
And I want to, first congratulate you. You are a member of the very exclusive 1% Club.
Yeah.
That is 1% of CEOs who are not only female, but are Black.
Yeah.
And that is a very, very small club to be in.
Yeah.
So while that is great to be in that exclusive club, I want to just really ask you about, first of all, your leadership style and how did you get there?
Yes.
What did you have to break through? And then also just literally your advice for why it shouldn't be so hard for others to be at the same level of executive position that you are at.
Yeah, well, thank you for that. I do think it's important to acknowledge that, everyone has a different leadership journey and everyone has their fair share of challenges. But I think for me, in sort of specifically to your question, representation matters, right? So for me, when I looked around the room to see who looked like me at these tables, there weren't a lot.
Right.
There's some, folks like Ursula Burns, Roz Brewer, certainly are role models for folks like myself who are up and coming in this industry. But I think at the core, when I talk about representation, it's two things. One, especially being in venture, right?
Yeah.
When I go to these investor talks, I don't see a lot of folks on the other table that look like me.
Right. Right.
So first, it's creating sort of opportunities for more representation on the venture side of the table, right? Because we know people tend to do business with folks who look like them.
That's right.
Right?
That's
and
right.
So I think that's one. Two, I think it's also this idea of having a little bit of bravery, right? To sort of put your hand out and say, I'm ready. I think we know this as women. We tend to want to check every box before we apply for a role.
Right.
Right?
Right.
And don't do that. Men
Right.
go, if I kind of can do that, I'm going to go for it.
Exactly.
Right?
Exactly.
So I think it's part of, for me, it's also having the acknowledgement to say that if I believe I have the skills, I have the passion, I may not have all the answers, but I believe I have what it takes, go for it, right? And there's a little bit of a go for itness that I want to see us have to really create more opportunities for all of us at that table.
The problem is so large.
Yes,
I mean,
yes.
for women-led companies, they are receiving 2% of the venture funding. 2%. That needle has not moved significantly. And for women of color, that is significantly lower.
Yeah.
And when you talk about not a lot of people who look like you on other sides or same sides of the table, we're talking about a very, very, very few amount of people. So maybe firstly, who do you surround yourself with? Because I think that you're absolutely right. We need more people, on the other side of the table. But that equation will not change rapidly enough to have 5 more women CEOs that look like you at your level of talent and caliber, out there doing the level of work that you're doing. So who do you surround yourself with?
Yeah, I love that because I do think it's important to think about your sort of board of directors, your circle of trust, if you will. For me, I'm very fortunate to have married my junior high school sweetheart.
Wow.
We've been since I was 13. It's kind of ridiculous. But what's awesome about that is that my husband and my son are my first cheerleaders. Right. And so I do think whatever that looks like for you in your life, having a strong core and center to sort of ground and frankly escape sometimes of the things you do in your professional life is so important. I'm a big believer in sort of self-care and self-improvement.
Yep.
And I tend to surround myself with folks who are like that. I belong to a mastermind group.
Uh-huh.
We meet once a month on Saturdays. We share leadership ideas and inspire each other.
Uh-huh.
I'm also a member of Chief.
Uh-huh.
And that has been an amazing outlet to meet women in my level and sort of who are working at my level of leadership.
Yep.
Because again, no matter if you're in healthcare or tech or finance or whatever, there's a certain level of challenges we all hit, right?
Yep.
At that sort of leadership level.
Yep.
And to have someone to bounce ideas off of and sort of share resources, share tips has been priceless. And of course, Redesign, right?
Yep.
Redesign, I think for me, my first startup is Redesign in this company, Syntax. I've been a corporate queen my entire career. And so being here and Redesign sort of supporting not only with the funding and sort of financing mechanisms, but also the infrastructure of other CEOs who are on this journey with me have been incredible for support.
Yeah. Well, Rachel, when you talk about it, I mean, just to comment, I mean, it really does sound like you have it all put together, and you're making it sound easy.
No.
And I just don't believe for a second that it has been anything but that.
Yeah.
So if you wouldn't mind sharing perhaps when you've been in one of those moments where it wasn't easy for the wrong reason. Somebody didn't expect your credentials to be all that, and they didn't believe that you were the executive that you are, or whatever the issue might be. How, in a moment, did you deal with something like that? Because I think those issues are everywhere. And women who are of color, they need to know how to deal with it, because we're not systemically the issues. We're not changing those overnight.
No, and that's life, right?
Yep.
So thank you for saying that I look like I have it all together. That was the point.
Great job.
But I'll tell you, one of my favorite analogies is like, you're like on this, like a duck, right? On the surface, nice and calm, flapping like underneath. that is the vibe. But I'll tell you that for me, to answer your question about sort of like what's a moment when you felt like, okay, this is all falling apart. When I was back at Anthem again, I had the opportunity to do an entrepreneurship.
Yep.
Where we were going to sort of take one of our sort of internal products and commercialize them. And I'm like, sign me up. I'm ready. Put me in, coach, right?
Yep.
And we started on this path, and we're like building a team. I hired a sales team, an account management team, and we're off. We had our first little contract and a client, and then leadership changed. And they were like, oh, we're not doing that anymore. We're going to bring that back in-house. So now I had to lay off people who I brought in and who I sold into this vision, right? And I took that personally for a moment. Laurie, I did. I felt like I let these people down.
Yep.
And that was definitely like one of those earth-shaking moments. And so 2 things I learned from that. One, pick your head up every now and then and read the room.
Yeah.
If I was reading the room a bit more, I would have seen the signs and the winds changing. But I was heads down, focused on just go, go, go. Which again, a lot of women, especially Black women, have been taught work twice as hard to get half as far.
Yep.
Right. So I was just working.
Yes.
And I wasn't looking around.
Yes.
And I didn't see the politics changing.
Okay.
Right. So I learned about that. Second, I also learned about grit and grace. Everybody who I sat down and talked about, like, hey, this is what's going on. There's been a change in leadership. I'm going to do my best to help you land somewhere in the organization or to help you land somewhere else outside. It wasn't like, oh my God, you're the worst person in the world. It was like, thank you for telling me, number one, transparently, tactfully, and then partnering with me to help me through the transition.
Okay.
And I think that comes down to grit and grace.
Yeah.
You have to have grit in any business that you're in. You have to have a little bit of like suck it upness.
Yeah.
Right? Stuff is going to happen. You're going to suck it up. But then can you be graceful? Can you be thoughtful in the transition, no matter what it is?
Yeah.
And come out on the other side.
Yeah. And pretty impressive also that you can emotionally remove the taking it very personally and
tough.
Lean into the leadership lesson that comes with that. I mean, that's even more than grit and
that's
grace.
The calling.
That's incredible.
But that's the calling, right? We're all called to lead at some point, no matter what level, no matter what title. And I think whenever you can take yourself out and sort of be called to the moment, right? That's when true leadership shows up.
Yeah, well, the leadership is definitely showing up right here.
Thank you.
So, Rachel, this is just an incredible conversation, and I really appreciate it. As we close out with Inspiring Women today, maybe just so you've already shared really just unbelievable advice, but as you speak to other women, younger, aspiring women who want to be Rachael Jones,
Oh my
what
God.
do you tell them?
Well, first, don't be Rachael Jones, be yourself. There's only one of you. I think a couple things come to mind. One of the questions you had in sort of the prep for this, I love so much about sort of claiming credit for your accomplishments. I don't know where I learned this. It might have been one of my early mentors. I started keeping like a little win log. First it was a journal, and now it's on my iPhone and my notes. But every time you have a personal win, a professional win, record that.
Wow.
Because men brag on themselves without even asking. They're just like standing around a coffee table and it's like, hey, did you know I closed this deal? We don't do that, right? And so I think for me, I've always started to keep, early in my career, I've kept this sort of win log. So I can sort of reference those wins in an interview, in a moment, at a cocktail party, and start to talk about sort of positioning yourself as a leader and as a winner from the start, right? Second, I think it's really important to know your worth in ad tax, right? We need to research roles. We need to understand what the comp is for those roles. Don't be afraid to ask for that.
Yes.
Know your experience. Again, that win log, right?
Yep.
So you can stand on that confidently. And at a certain level, you have to just go for it.
Yep.
And you have to know that you are enough and that all the things you've done, you'll rise to meet the moment and you'll be successful.
Rachel, this is just like an unbelievable boatload of excellent information. I so appreciate it. This has been an excellent Inspiring Women interview. I've been speaking with Rachael Jones. And Rachel, thank you so much.
Thank you. Pleasure to be here.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.